Hi, my name is Craig Zalvan, and I'm the medical director of the Institute for Voice and Swallowing Disorders at Phelps Memorial Hospital. I'm a laryngologist, and that's an ears, nose, and throat or otolaryngologist who specializes in voice and swallowing disorders. What I want to talk to you about today is hoarseness. Hoarseness is something that affects all of us at some point in our lives. Whether it's a change in voice, breaks in the voice, cracks, trouble singing high notes, breathiness, or recurrent loss of voice every time somebody gets sick, it signifies there's a problem with the vocal cords. And my focus is to help identify what those problems are, and then through proper treatment, rehabilitate the voice and remove these recurrent problems that affect people's lives. The primary way that we diagnose these problems of the voice is with digital video stroboscopy. And this is really the gold standard way to identify a problem on the vocal folds and inside the throat. By using stroboscopy, I can identify lesions of the vocal folds, such as polyps, nodules, or cysts in the vocal folds, which can greatly affect the voice, not just the singing voice, but the speaking voice as well. In addition, I can see other problems such as vocal paralysis or weakness of the voice box, and other lesions and other problems such as reflux disease, which really is a problem that affects many people and can affect the voice as well. In this example here, you see a singer who was at a sporting event and was yelling and had an acute hemorrhage of the vocal fold, which then over time formed into a large polyp of the voice box. And this greatly affects the voice, both the singing and speaking voice, with this large lesion that you see right here. The way that we treat any problem with the voice is either a combination of voice therapy or surgery, or obviously a combination of both. At our institute here, our voice therapists are classically trained singers, have professional music background, professional speaking background, and are able to work with the person who's having a problem to rehabilitate the acute voice problem, and most importantly, prevent future problems from coming. If voice therapy, which is typically tried first, does not get the person to the voice they need, then the next step would be a surgical technique. And surgery is a very specialized type of surgery that laryngologists are trained to perform on the vocal folds, which removes the abnormal tissue and maximally maintains normal tissue so that normal vibration can occur and thus normal sound. And this greatly improves the results. Almost all patients who've had any type of surgery will then require aggressive voice therapy to rehabilitate the voice.